Coming to the concept of the normal puerperium, let's define the word puerperium. Puerperium is the period after birth at which the body tissues, especially the pelvic organs, except the breast, will undergo a change that will revert them back to the pre-pregnant state, both anatomically, physiologically, as well as psychologically. The woman who is undergoing the labor um, is called as the parturient woman, while the woman who is in the stage of puerperium is called as a puerpera. Coming to the duration of this puerperium, it will be extending from for a period of 6 weeks, and it can be divided into three parts. That is immediate, which is for 24 hours, and the early period, which will be up to 7 days, and the remote period, not the late, it is the remote period, which will be up to 6 weeks. Remember that in abortion, the similar process occurring, but faster changes will occur in abortion. Coming to the involuntary changes, that is those changes which will bring back the uterus to its pre-pregnant state. Is what is explained below. First is the anatomical consideration, then we will consider it physiologically. So first let us go with the anatomical consideration. Anatomical consideration in case of uterus. Here, and the uterus will convert from a pregnant state, which was having a 8 by 5 by 3 inches diameter and 1 kg weight, and it will convert into 4 by 3 by 2 and 6 gram weight. And remember that the placental site will undergo a rapid contraction. Do you know why this is? It is because the placenta is the site where some parts of placenta might be still present, so the uterus tries to contract rapidly over here, so that whatever the remnants that are present, which were attached to the placenta, will get easily removed off as early as possible. Okay, and remember that even after 6 weeks also, this part where the placenta was attached to will remain elevated only. Coming to the lower uterine segment, the lower uterine segment will be involuting back in just some few weeks, and it will become a thin, flabby, collapsed structure. It becomes what? It becomes a thin structure, it becomes a collapsed and a flabby structure. Coming to the cervix, the cervix now has slow contractions, and slow contour changes will be undertaken by the cervix, and by the end of 1 week the cervix will have so much contracted that, and there will be, we can just insert our tip of fingers at the end of 1 week, and the external os never returns to the original nulliparous state. Coming to the physiological consideration, so we have discussed all the pelvic organs, that is the uterus and the cervix also. That is particularly since the uterus undergoes the major changes, so we have discussed only the uterus. Now coming to the next one, that will be the physiological consideration, for which by which involution of the uterus becomes evident. So there is first changes take place in the muscle, there is change taking place in the blood vessels as well as in the endometrium. Coming to the muscles, from the in the pregnant state, there was a hypertrophy as well as hyperplasia, but during the puerperial stage, due to the action of the uterine collagenase and the proteolytic enzymes, and these become active due to the decreased levels of the progesterone and estrogen, and due to this action, that is uterine collagenase and the proteolytic enzyme action, there is constantly loss of the muscle size. The muscle size gets diminished now, but the number of fibers remain the same. As a result of it, there is excess of creatine produced in the body. As a result of it, creatine becomes a very important excretory product which the kidney has to expel out. Coming to the next one, that will be the blood vessels. The blood vessels will constrict now, because the muscles get constricted. As a result of it, there is occlusion of even the arteries and veins, due to which there is thickening of the intima taking place in the arteries. As a result of it, there is thrombosis of the blood. Because of continuous contraction, the blood gets stagnated. Due to stagnation of the blood, there is thrombosis of the blood. After the thrombosis, there is hyalinization of the blood vessels. Due to the hyalinization of the blood vessels, there is endoarteritis also. And remember that here, the thrombosis at the thrombotic side, new vessels will start to grow. Coming to the veins also undergo thrombosis, then hyalinization, and finally endophlebitis. And the endometrial changes can be summarized like this: the degenerative changes first, during the immediately after the delivery, there are degenerative changes to remove of all the remnants that were present. For example, the fetal membranes, the remains of the placenta, and the decidua of the endometrium. All these will be getting removed slowly and gradually, and these will be getting excreted out of the uterus as lochia. Very very important term. And finally, after all this, it is at the seventh day and the regenerative changes back to the pre-pregnant state will be taking place. That is when it is on the seventh day, and the epithelium gets completely regenerated by the end of 10th day, while the endometrium will regenerate after the 16th day. And remember, very importantly, the placental site will get regenerated only after 6 weeks of puerperial state. Coming to a general concept, that is the clinical assessment of the involution. In order to assess the involution, first the person should be asked to empty her bladder first. Then after that, the second thing you need to do is to centralize the uterus, and finally look at the uterus. Usually during the first 24 hours, there is no decline in the, or there is no decrease in the fetal in the fundal height or the uterine enlargement. But after that, after one day, there is a steady decrease in the height by approximately 1.25 centimeters, or 0.5 inches decrease in height. Height takes place every 24 hours till the second week. But after second week, the uterus starts to but after second week till 6 week, it will be starting to decrease its fundal height, still slowly, at the rate of just 1 centimeters, or approximately 1/4 of an inch every day. And finally, it reaches to its normal pelvic organ state by the end of 6 weeks. This is an important thing you have to remember. Involution of other pelvic structures. The vagina takes long time of approximately 6 to 10 weeks to recover back towards pre-pregnant state. But whatever the recovery is, here the recovery will be incomplete in nature, and the mucosa remains delicate for a few weeks, and the submucous venous congestions, that is the Jacquemer sign, will be persisting for a very long time in the vagina, and the rogae will be also appearing in the vagina, but not to the extent when it was in the nulliparous state. Coming to the hymen will remain lacerated, and it cannot be restored to its virginal state, and the introitus, or the point of the external os, will never return back to its original state. It will permanently remain larger than the nulliparous state, and having a flattened big hole. And then the round and the broad ligaments also will be retaining, will take a considerable time to recover from the stretching and relaxation. The pelvic floor, as well as pelvic fascia, also takes a longer time to recover. Coming to the concept of lochia means the discharge that will come from the uterus, cervix, as well as especially from the vagina at the first fortnight during the puerperium. Remember that it does not take place for 6 weeks; it takes place only for the first fortnight, that is for only till the 14 days after the delivery. Okay. And this lochia is essentially the waste products that were present in the uterus after the delivery, like the decidua, lanugo, meconium, as well as the placental remnants, cotyledons might have been present sometimes, the blood, as well as the hemorrhage that might have acutely formed in the uterus, or it can be even the fetal membranes, even the decidua, vera capsularis, all these will be present. No, so all these things should not remain in the uterus. Now they should get excreted. So this is the mechanism which the body of the female adopts to excrete the waste products post delivery in the form of lochia. Okay. And the odor of this is like a fish offensive, and it has a fishy smell, and the reaction is alkaline in nature. The color, based upon the color of the lochia, it can be divided into three types, that is lochia rubra, lochia serosa, as well as the lochia um, alba. This lochia rubra will be occurring from 1 to 4 days it will occur, and this will contain, as the name suggests, it consists of more amount of blood. It consists of decidua, fetal membranes, lanugo, and meconium also. And the lochia serosa will be brown or yellow or pinkish in color. It will be it will be excreted for from 5 to 9 days, and it has less amount of RBCs but more amount of leukocytes are present in it. It consists of mucus as well as the microorganisms, that is the mucus and microorganisms are present. Which are the microorganisms? That is the anaerobic bacteria, like the streptococcus or the staphylococcus, and all these are physiologic in nature, unless if it is proved by the presence of sepsis in the uterine region. In the lochia alba, there is more amount of, almost there will be more amount of leukocytes and mucus, and even the microorganisms will also be excreted here also. Remember that the volume of this lochia per day will be 250 ml, and the duration of this will be decreased in case of um, um, premature birth given woman, and in case if it is a twin delivery, or if it has a polyhydramnios, that is more amount of amniotic fluid was present, then there will be excess amount of lochia secreted. Coming to the general physiological changes during the puerperial period, the pulse rate. The pulse rate increases immediately after the normal delivery. For a few hours, it will be remaining rest, but it will settle down during the next day itself. It will come down. Coming to the temperature, will there will be hyperthermia thermia condition only for the 24 hours after delivery, after which it becomes normal. During the second day, it might rise just by 0.5 degrees Celsius, but it will come down. It will also come down to normal in some few hours. It is only during the third day that there will be a rise. There will be a increase in the temperature due to the increased breast discomfort and the breast engorgement, which is due to the breast engorgement. And whatever be the temperature change, it should come back to normal very soon. But if it long lasts, then it is a abnormal condition. Coming to the urinary tract, and the urinary tract will have already undergone edematous as well as the hypertrophy during the pregnancy. It will be storing a higher capacity of urine during the pregnancy state. Now when the delivery has already taken place, there will be still over distension of the urinary bladder, and due to which there will be not much contractions happening, due to the lax and loose abdominal muscles. As a result of it, decreased abdominal pressure will be coming, and due to this loss of the pressure to evacuate the urinary bladder, there is residual urine. As a result of it, there are more chances for urinary tract infection in the puerperial state. Coming to the GIT, there is increased thirst condition to eliminate the excess of sodium and the potassium that were present, and there is more chances of constipation due to decreased motility in the GI tract. Coming to the weight loss, the after the birth, there is loss of 5 to 6 kg due to the expulsion of the fetus and all the products of conception, and in addition to that, there is also a additional loss of 2 kg in the puerperium period. Fluid loss, net fluid loss will be 3.5 liters. In that, 2 liters will be lost just in the first week itself, while 1.5 liters will be lost in the next 5 weeks. But the factors which are going to determine the fluid loss are the pregnancy state, as well as the dehydration that was suffered during the labor, as well as the blood loss during the delivery. Remember one more important thing, that is the in the gastrointestinal tract, the constipation becomes a common because of the decreased GI motility, as well as due to the mild ileus following the delivery, and together with the perineal discomfort causes the constipational problems. Coming to the blood values, there is decrease in the blood volume, increase in the cardiac output, the hematocrit and RBC volume will return to their normal state in just 8 weeks, and leukocytosis still occurs so as to prevent any further infections in the body. There is decreased platelet counts, which acts as a protective mechanism to prevent the thrombosis, because pregnancy was a hypercoagulatable state. As a result of it, this decrease in the platelet count will act in the favor of anticoagulation, and therefore they will prevent any kind of thrombosis formation, or the risk of thrombosis will be decreased in the puerperial period. Coming to the next concept, that is about the ovarian functions. Remember that in the lactating mother, 10 weeks it will be 10 weeks um, after the delivery, the ovulation will take place, but in non-lactating mother just 4 weeks are enough, after which the ovulation will start to take place, and the contraception will be naturally adopted till the third postpartum month, minimally in a lactating mother, while in a non-lactating mother it will be just till the third postpartum week only. Therefore, the first point relates to the ovulatory functions, and the second point relates to the amenorrheic functions. Women who is exclusively breastfeeding, the contraceptive protection is about 98% up to 6 weeks of postpartum, but 100% it will be in the third postpartum month, not week. Coming to one more important thing, that is about the thyroid. The thyroid will return to its pre-pregnant state by 12th week. It will take approximately 12 weeks to return to its normal function, but the thyroid functions will return to normal by 4 weeks postpartum. Women on thyroid medication should get their thyroid function checked by to readjust the drugs. So let's study about the concept of lactation. Composition of the colostrum. The colostrum, remember that the production of this milk will start to take place from 12th week, and in the form of colostrum. And this colostrum is a deep yellow serous alkaline fluid which is rich in proteins. It is rich in vitamin A and the sodium chlorides. It is rich in, as well as in immunity providing substances like the IgA, IgG, IgM, lymphocytes, as well as complements lactoferrins and lactoperoxidases. It is a little bit poor in the carbohydrates, fats, as well as in the potassium. Remember that the fat produced are the large flat globules, and these act as a laxative to the infant. Coming to the physiology of the lactation, the lactation takes place in four important steps. And the first one is the mammogenesis, where there is preparation of the breast. The second one is the lactogenesis, where there is synthesis and secretion from the breast, and galactokinesis, where there is ejection of milk, and the galactopoiesis, which is the maintenance of the lactation. Mammogenesis, this mammogenesis, which is the preparation of the breast, which will be starting during the pregnancy itself, wherein there is increased growth of the ducts as well as the lobular alveolar system. All this is stimulated by the production of the various hormones of pregnancy, like the estrogen and the progesterone. Coming to the lactogenesis is the production of the synthesis and secretion of milk from the breasts, and which is coming from the alveolar cells, of course. Though this milk secretion will actually start on the third or fourth postpartum day. Around this time, the breast become engorged, tense, tender, and they will be feeling warmer. And the important hormones of this stage are the prolactin, insulin, growth hormone, as well as the glucocorticoids. Even the estrogen and progesterone also have some part in. Coming to galactokinesis, oxytocin is the most important part of this galactokinesis, that is the ejection of milk process. And it also this galactokinesis also depends upon two other things. That is, first, since it is a neuroendocrine reflex, it depends first on the suckling of the milk. Okay, that is, when the infant suckles, it causes a neurological stimuli, which are present, the touch receptors which are present in the nipple of the breast will get stimulated, and they will send us a signal through the T4, T5, and T6 to the hypothalamus, stimulating the paraventricular nucleus, and this paraventricular nuclei will be producing the hormone oxytocin release, and that gets released into the posterior pituitary. This posterior pituitary, when it releases this oxytocin, it acts on the myoepithelial cell as well as on the duct cells, causing their contractions. As a result of it, there is production of the ejection of the milk takes place, whatever was stored in this ducts as well as in the alveoli. And the oxytocin not only ends up its function there itself, but it also stimulates the GI system, causing increased GI motility and secretion of GI hormones. It also causes contractions of the uterus to expel the residual parts of the uterus. That means it helps in the production of the lochia in the uterus. That is a important point to notice. Coming to the next one, the next step, which will be the galactopoiesis. Before going to that, milk ejection reflex will be inhibited by pain, anxiety, and breast engorgement, or other adverse psychic conditions like depressions can cause the inhibition of this milk galactokinesis. Coming to the galactopoiesis, the most important, single most important hormone of this is the prolactin, which helps in the maintenance and continuous lactation. And the frequency of suckling should be usually greater than 8 times in a day, and the milk pressure reduces the rate of production, and hence periodic breastfeeding is a very important point. The milk production, in the milk production, usually 500 to 800 ml of milk will be produced per day. For that, there is minimum requirement of 700 kilocalories of energy will be used in this production of milk. For that, the body must have at least 5 kgs of fat stores to help in the process of lactation. Stimulation of the breastfeeding, and it will be stimulated much early, just half to 1 hour, and exclusively the breastfeeding should be done by the mother to the infant in a correct position. Breastfeeding should be done just at an interval of 2 to 3 hours per interval. There should be just a gap of 2 to 3 hours only. After that, immediately breastfeeding should be continuously be done, so that the infant won't become hungrier. And remember that the galactokinesis process can also take place just by the infant's cry also. Coming to the lactational failure, the cause of this lactational failure or the suppression of the lactation is due to the endogenous suppression of prolactin, which is in turn due to the consumption of the ergots, as well as use of pyridoxine, diuretics, or retained placental bits might be the cause of the inadequate milk production. Even the pain, anxiety, and insecurity may be some of the hidden reasons. Unrestricted feeding at short intervals, of the intervals of 2 to 3 hours, will be helpful in the milk production. To avoid, so therefore, to avoid the lactational failure, you have to breastfeed the infant frequently. And what prevents this will be some of the psychological causes of pain and anxiety, and the other pain, anxiety, and depressions, and even the ergot preparations, and pyridoxine and diuretics also will be causing the lactational failure. Coming to the galactogogues, also called as the drugs to improve the milk production, metoclopramide 10 mg should be given thrice a day, which will cause increased milk volume because of the increased stimulation of the prolactin secretion. Sulpiride as well as the domperidone also does the same thing, and the intranasal oxytocin can also be given. Remember that the bromocriptine shan't be given to suppress the milk production in case of aborted or non-lactating mothers, because it has many side effects of hypotension, myocardial infarction, and puerperial stroke. So in order to prevent the lactation, that is to suppress the lactation, the following methods will be observed. And that is, first, to stop the breastfeeding. Second one will be to avoid pumping or milk expression. Third one is to use or wear a breast supporter. And the fourth one will be the use of ice packs. And the fifth one will be use of analgesics like aspirin to relieve the pain. Sixth will be use of tight compression bandage for at least some 2 to 3 days. And inhibition of prolactin secretion can cause breast involution. And the breast milk for a premature infant might be beneficial in many ways. And remember that the breast milk is most important compared to the formula milk, because it prevents all the medical metabolic disturbances like the azotemia, hyperaminoaciduria, hyperaminoacidemia, and metabolic acidosis also. Coming to the management of the normal puerperium, it will have four stages. First is to check to restore the health of the mother. Then the infection prevention to mother, and third one will be breast care, and finally the contraception motivation to for the contraception. Coming to the management of the normal puerperium, first is the rest and ambulance. Mother should be ambulated so that the bladder complications can be decreased. You will feel a sense of well-being, as well as there is increased involution of the uterus. That is, it hastens the process of involution. Coming to the hospital discharge, she should be discharged only after 2 days after finding that she is fit and healthy to go home. And her diet should have a high calorie, so that whatever the calories that are consumed for the breastfeeding will get compensated. And the bladder care, unaccustomed position, as well as reflex pain of the perineal injury causes this troublesome micturition. And coming to the bowel care, excess of fluids and roughage should be given so as to cause bowel clearance easily. And sleep should be adequate. And if there is some kind of pain during the sleep, or due to the engorged breast, ibuprofen should be given, which is an analgesic. And In the breast care, there might be sometimes nipple soreness, which is due to the dryness of the nipples, which is due to the prolonged feeding after a long period of time, which should not be done. Instead, it should be the infant should be breastfed at a shorter intervals of time itself. And nipple confusion is the non-acceptance of the natural nipple of mother in and accepts the artificial nipple. Coming to the immunization, TT injections, hepatitis B, BCG injection, Tdap injection, as well as rubella vaccine, all these should be given. And the after pain, what do you mean by? There are two important terms now in this. That first is the after pain. After pain are the spasmodic, infrequent pain in the abdomen, which will last for 2 to 4 days after the delivery. And then the treatment of this will be of three kinds. The first is massaging the uterus. Second thing is by clearing the residual contents present in the uterus. And third thing is by giving the analgesics. Let me repeat, this is very important. That is, first is by massaging the uterus, that is physical way. Second one will be the mechanical way of expulsion of the remnants present in the uterus. And third one will be the chemical way, wherein there is use of the drugs like the ibuprofen will be used to relieve the pain. In case of perennial injuries, sits baths, hot or cold, must be given, and ibuprofen should be given to the patient. Correction of anemia can be done by giving ferrous sulfate tablets of 600 mg to uh, prevent further severity of the anemia. Coming to the last thing, that is the rooming in. In this rooming in, this starts from the first few months after birth, and it is manifested by bonding, kissing, cuddling, and gazing at the infant. And this not only establishes mother-child relationship, but it also makes the mother understand the art of the baby care. And in this, the mother should be usually with the baby in a cot beside her bed always. So some of the baby-friendly hospital initiative steps are the following. The first one is the have a written breastfeeding policy that is routinely communicated to all the healthcare staffs. Second one is to train all the healthcare staffs in skills necessary to implement the policy. Third one is to inform all pregnant women about the benefits and management of breastfeeding. So basically, this in baby friendly hospital initiative is a postpartum policy. Okay, it is for the postpartum mothers, and and to help mothers to initiate the breastfeeding within half an hour of birth, and to show mothers how to breastfeed and maintain the lactation even if they should be separated from their infants. Sixth point will be to give newborn infants no food or drink other than the breast milk. So we can group this fourth, fifth, and sixth point as one, and one, two, and three as one, and practice the rooming in concept, that is allow the mothers and infants to stay in the room for together 24 hours a day. Encourage breastfeeding on demand, and therefore you can even include the eighth point to the sixth point. Seventh point is a different one, that is rooming in concept. And the ninth point will be give no artificial teats or pacifiers, also called as dummies or soothers, to breastfeeding infants. And the 10th point is to foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic.